Hi everyone, I'm Natalie. I'm the Wholistic NP, and today I'm going to show you just briefly how I do Lebowitz Protocol. I do Lebowitz Protocol with this kit here that I got from Dr. Lebowitz. If you can see here, it's got a bunch of different vials, different sections. They're all color coded. They look really fun. This first section right here is microbes, so that's anything like viruses, bacteria, parasites, mold. We've got chemicals and toxins. We have heavy metals. We also have hormones in here. And what else did I miss? Heavy metals, I did talk about that. Oh, and food sensitivities. That's this middle section here. So I have a patient here today who has some chronic symptoms. So I thought the best way to see what's going on with the body in real time is to do muscle testing and to use these vials. So for anyone, especially children who are afraid of having their blood drawn, or they've done blood work and it's perfect, yet you don't feel good, this is an excellent tool to come in and have this done. So I'm going to set up here. Put my vials right there. Are you comfortable? Excellent. Okay, I've got my magnet. And the magnet that I have here in my hand, this allows me to test more accurately. This magnet will go on his head along with each of the vials that I'll be testing. Now, the second part of the visit is also testing all of these supplements by Dr. Lebowitz. So these are all Supreme Nutrition supplements. And the nice thing is that the first part, the body will reveal to me through the muscle test what it's reacting to, whether it's a virus, a toxic heavy metal, a food sensitivity. So then towards the second part of the visit, after I check everything first and see what vials he tests positive for, then I go back and I put each of the supplements on his head as well. And I muscle test to see which supplement his body wants for whatever is coming up today. So it does not get more accurate and individualized than muscle testing for the supplement that his body is asking for right as we test for all of these things. So that's what these are. I'm going to set these aside. And just like anytime we muscle test, we're going to start with checking a muscle test of strong muscle first. So you're just going to have your arm straight up like this, and I would like you to match my resistance. So you're holding your arm. We're not locking the arm. We're not letting it be too lax, but we're just meeting with equal resistance. So if I apply more resistance, which you can't tell in the video, I'm applying resistance, his arm is not moving. So this is what we want. This is a neutral muscle test. And just so that you understand at home how this works is that a neutral muscle test right here, right? I'm checking, there's no changes right here. This is rest and digest. There's no stressor to the nervous system or the body. So this is the brake. Think about a car and you have your foot on the brake. This is a neutral muscle test. Foot is on the brake, all is good, nothing is happening, all is great. Now, once the body goes into fight or flight for whatever reason, in this case, me putting a microbe or some other type of pathogen on his head, if he reacts with whatever is in the vial, instead of being in rest and digest and the brake is on, all of a sudden, he's going to switch over to fight or flight, which is the sympathetic nervous system. When we engage the sympathetic nervous system, the foot moves from the brake over to the gas pedal. So what will happen is, as I put something on his head and he's reacting to it, he goes into fight or flight. As I'm checking the muscle test is going to go down because now the foot is on the gas pedal and the car is going. So the muscle test, instead of being locked like this in neutral, you're going to see it go down like this. That is what we call a weak muscle test. And anytime we go from a strong muscle test to a weak muscle test, that tells me that there's something going on in the body, and this is in reaction to what I just put on his head. So for some of these, we are going to do different hand positions or foot positions as we move through the different sections. I'm just going to go through the first section, which is the pathogens. I find that to be one of the most interesting components because as a holistic nurse practitioner that's certified in functional medicine, I see a lot of really sick patients and then I need to treat them. So I can test them first and then put together their protocols, what foods to avoid, what supplements to take. In this case, these specific supplements that he tested for during the Lebowitz Protocol, and then put that together, and then he can essentially start the treatment right now, after the appointment. And usually what we do is after we do this type of muscle testing, With the vials, we have the patient come back in 3 to 4 weeks. And whatever tested positive the first time, I will recheck and see, oh, now it's strong because he's been on the right herbs and he's been on the right treatment. And then we recheck everything, and usually what I find is that most of the time, everything comes back as strong. If it's still weak, that usually means that the patient needs a little bit more of the treatment and needs to take the supplement a little bit longer. So for this first section, we're going to go through microbes and pathogens. So this arm, we're going to bend it and just place it over your head. This is the arm position that we need to be in. So by doing the correct arm positions and leg positions, which have been indicated by Dr. Lebowitz, and by using this magnet with a provocation vial, this is going to be as accurate as possible. So I've got my vials here. I'm going to grab one. So I've got my 2 vials now. I'm going to place that right over his head, and if you don't mind extending that arm. So again, we're going to start with a neutral muscle test. So hold it there. Don't let me move it. We're going to apply the magnet and the vial and see what happens to his muscle test. So in this case, whatever I put on his head, his body is not reacting. So I'll put this one back, and I'm just going to go down. So this one he is reacting to, so I'm going to set this one aside to come back to. And essentially, hold here for me. We're just going to keep going through. So no change here. Put that one back. Go on to the next one. Hold for me. Very good. No change. We'll put that one back as well and go over to our next one here. Hold for me. So his body is reacting to this one. You can see his arm weakening, which is happening without his control. That's the nervous system kicking in, reacting to the vial. The one other thing we have to keep in mind with muscle testing is that, again, here's something he's reacting weak to, so I'm going to put this one aside as well. You want to be well hydrated whenever you do muscle testing, whether it's for Lebowitz Protocol, something like NET, which stands for neuro-emotional technique. This one is weak too. The more hydrated the patient is, and myself included, the more accurate the muscle test will be. And these are principles of applied kinesiology. So this one is strong. I can't seem to move his hand, so we're going to put that one back and keep going here. And that one is strong too. So you're kind of getting a glimpse of how this works. What will happen is I'll go through the whole kit. Thank you. You can put your arm down. We'll go through the whole kit, and then at the end, he's already had tested positive for 4 vials here. What I'll do at the end, and mind you, I don't look at these. I don't even know what I have in my hand because the writing is very small. They're all out of order, so I don't even know what's here. But after we check all of these, I would move on. I would take my Supreme Nutrition supplements here. He'll put up his arm. We don't need the provocation vial for that part. And we would do this on a weak muscle. So the way that supplements work, so you're going to twist it all the way out like that, and we're going to start with a weak muscle. So what I'm looking for with supplements, once I've tested the vial kit, I would put each supplement on his head. We have a weak muscle, and what I'm looking for is for that muscle to go from weak to strong. So when checking for something that your body needs, there should always be a strong response. If it continues to be weak, that tells me this is not the supplement for him, and I'm going to keep going until I get supplements that he tests strong too. So we go from a weak muscle to all of a sudden a strong muscle. That's his body telling me, yes, I like that supplement. That's what I want. And then that's what I'm going to put him on. And thank you. You can rest your arm. And this is something that can be done in the office with no preparation. You don't have to fast. You don't have to get your blood drawn. You don't have to do a stool test. You literally have to do no testing. All you need to do is come into the office, drink water, be hydrated, relax, right? Is this pretty relaxing? Mm-hmm. Absolutely. You're laying down the entire time, and I can run through this in less than half an hour. And then you can be on your way and start your treatment protocol. So if you're interested, please give me a call. It's 561-365-8131, and I would love to see you and help you on your health journey. Stay well.